January 1946 – the 13th of January 2004, known to acquaintances as Fred Shipman, was an English doctor in general practice and serial killer. He is considered to be one of the most prolific serial killers in modern history, with an estimated 284 victims over a period. Harold Frederick Shipman was born on the 14th of January 1946 on the Bestwood Estate, a council estate in Nottingham, the second of 3 children. His father, also Harold Frederick Shipman, 1914-1985, was a lorry driver. His mother was Vera, née Britton, 1919-1963. His working-class parents were devout Methodists. Shipman was particularly close to his mother, who died of lung cancer when he was aged 17. Her death came in a manner similar to what later became Shipman's own modus operandi in the later stages of her disease. She had morphine administered at home by a doctor. Shipman witnessed his mother's pain subside, despite her terminal condition, until her death on 21 June 1963. On the 5th of November, 1966, he married Primrose May Oxterby. The couple had 4 children. Shipman studied medicine at Leeds School of Medicine, University of Leeds. Graduating in 1970, Shipman began working at Pontefract General Infirmary in Pontefract, West Riding of Yorkshire, and in 1974 took his first position as a general practitioner, GP, at the Abraham Ormerod Medical Centre in Todmorden. The following year, Shipman was caught forging prescriptions of pethidine for his own use. He was fined £600 and briefly attended a drug rehabilitation clinic in York. He worked as a GP at Donnybrook Medical Centre in Hyde, Greater Manchester. In 1977, 10-11, Shipman continued working as a GP in Hyde throughout the 1980s and established his own surgery at 21 Market Street in 1993, becoming a respected member of the community. In 1983, he was interviewed in an edition of the Granada television current affairs documentary World in Action on how the mentally ill should be treated in the community. A year after his conviction on charges of murder, the interview was rebroadcast on Tonight with Trevor McDonald. In March 1998, Dr. Linda Reynolds of the Brook Surgery in Hyde expressed concerns to John Pollard, the coroner for the South Manchester district, about the high death rate among Shipman's patients. In particular, she was concerned about the large number of cremation forms for elderly women that he had asked to have countersigned. Police were unable to find sufficient evidence to bring charges and closed the investigation on 17 April. The Shipman inquiry later blamed Greater Manchester Police for assigning inexperienced officers to the case. After the investigation was closed, Shipman killed 3 more people. A few months later, in August, taxi driver John Shaw told the police that he suspected Shipman of murdering 21 patients. Shaw became suspicious as many of the elderly customers he took to the hospital, while seemingly in good health, died in Shipman's care. Shipman's trial began at Preston Crown Court on the 5th of October, 1999. He was charged with the murders of 15 women by lethal injections of morphine, all between 1995 and 1998. Sad Smiley 22, * Marie West 81, * Irene Turner 67, * Lizzie Adams 77, * Jean Lilly 59, * Ivy Lomas 63, * Muriel Grimshaw 76, * Marie Quinn 67, * Kathleen Wagstaff 81, * Bianca Pomfret 49, * Nora Nuttall 65, * Pamela Hillier 68, * Maureen Ward 57, * Winifred Meller 73, * Shipman's legal representatives tried unsuccessfully to have the Grundy case tried separately from the others, as a motive was shown by the alleged forgery of Grundy's will. On the 31st of January, 2000, after 6 days of deliberation, the jury found Shipman guilty, 23, of 15 counts of murder and 1 count of forgery. Mr. Justice Forbes subsequently sentenced Shipman to life imprisonment on all 15 counts of murder, with a recommendation that he be subject to a whole life tariff, to be served concurrently with a sentence of 4 years for forging Grundy's will. On the 11th of February, 11 days after his conviction, Shipman was struck off medical register by the General Medical Council, GMC. 2 years later, Home Secretary David Blunkett confirmed the judge's whole life tariff, just months before British government ministers lost their power to set minimum terms for prisoners. While authorities could have brought many additional charges, they concluded that a fair hearing would be impossible in view of the enormous publicity surrounding the original trial. Furthermore, the 15 life sentences already imposed rendered further litigation unnecessary. Shipman became friends with fellow serial killer Peter Moore while in prison. Shipman denied his guilt, disputing the scientific evidence against him. He never made any public statements about his actions. Shipman's wife, Primrose, maintained that he was not guilty, even after his conviction. Shipman is the only doctor in the history of British medicine found guilty of murdering his patients. John Bodkin Adams was charged in 1957 with murdering a patient, amid rumours he had killed dozens more over a 10-year period and possibly provided the role model for Shipman. He was acquitted and no further charges were pursued. 33. A historian, Pamela Cullen, has argued that because of Adams' acquittal, there was no impetus to examine potential flaws in the British legal system until the Shipman case. As of the 1st of December, 2023, Shipman, also nicknamed Dr. Death and the Angel of Death, is the only British doctor to have been convicted of murdering patients, although other doctors, such as Ishaka Mammon, 65, have been acquitted of similar crimes or convicted of lesser charges, 66. 67, and nurses such as Lucy Letby, Beverly Allett, Colin Norris, Benjamin Jean, 68, and Victorino Chua have also been convicted of murdering patients in their care, 69,